Hi, Dr. Ryan. As we discussed prior, I'm just going to be interviewing you for my massage class. This is an open interview. If you want to leave things out, that's totally fine by me. I'm just bringing up your biography here. It seems like you have a pretty colorful track record, and you've worked with veterans. I'm also currently in the military, so I really appreciate your assistance. I may need it in the future.
Thank you, Alexa.
I saw pictures of your dad. Would you be able to elaborate on maybe why you wanted to be a chiropractor?
Yeah, I'm coming in as like a third generation chiropractor and kind of continuing in that same path and being able to continue the family business is definitely something that's really important to me.
Obviously, you're not a massage therapist, but unfortunately, I couldn't get an interview with your massage therapist at your practice. So I really appreciate you taking the time to call me back.
No problem.
Thank you. My second question is, what's your ideal work environment? How do you like to be in the workplace? What's your ideal place of work?
I think ideally having like a balance between, being able to work independently and also kind of having a team that you can lean on definitely, helps because you can kind of make sure you're getting what you need to do done, but then also contributing and have someone else there that can, pick up some slack if there is any.
Every time I kind of like drive to school, I see your guys' practice. It looks smaller, but on the inside, it's like very homey. I remember you talking about race car driving and riding motorcycles. My dad really likes race cars as well, and he would be shocked to hear that you have raced at Daytona. When you helped your dad design your practice, did you have the say in putting all the cars on the wall, or was that him?
Yeah, I think you could definitely say that was part of my personality and me putting myself into the practice there.
I understand that you enjoy a lot of things outside of your practice. What do you maybe like to do to decompress?
I definitely do, regular strength training, like to bike. Exercise is really important, good to clear your head and kind of make sure you're staying in tune with your own body.
Yeah, that's really important. And then I saw on your website kind of you have like some nutrition things, and I noticed that you had like a gym in there. Do you help people with working out and like their diet and stuff?
Yeah, we do work with multiple techniques on muscle conditioning, strength training, nutrition, things that are going to help the whole patient as well. So we do have those options available in our practices as well.
That's awesome. My next question, Dr. Ryan, is what's the modality you use the most?
I would say the most I'm using, instrument-assisted soft tissue mobilization. A lot of patients come in, expecting us to like crack their back, but we're doing spinal adjustments. We're using tools to, do this tissue mobilization, release fascia, assist with their posture, helping correct kind of for a long term, so that they get a longer relief.
I know that you're a chiropractor, but we discussed prior that you're maybe getting some tips and tricks from Julia, your massage therapist. Is there any like continuing education things that you'd like to learn, like anything that interests you?
Cupping, I think that's definitely an interesting avenue to go down because it is not something that I've gotten to do much of, but seeing that it does have results for patients is definitely something I'd be interested in learning more about.
As you're, working day in, day out, assisting people, what is like the most difficult part of your work?
I definitely think, when you have a packed schedule and, you're taking care of many patients, just making sure that you're having that time for yourself to decompress and make sure you're also taking care of yourself throughout the day. That way you don't end up feeling, run down by the end of the day.
That kind of leads me into my next question. When you're, dealing with a bunch of other patients, like troubles, if you're willing to share, What might be a client story that sticks out to you the most?
Yeah, I think kind of in a general with a lot of clients, making sure that when you see them starting to improve and them becoming stronger in their range of motion, living with less pain, it can kind of make you emotional. Without saying any specific clients, but at the beginning they're kind of in more pain, and then by the 3 or 4 sessions in with chiropractic, they can start to feel a lot better, and they feel really good coming into their appointments and then also leaving.
In general, what's the best part of your job?
Well, in my case, because it's a continuing family business, I'm still kind of upholding that legacy and that part of the family, and then also patient outcomes of them getting better is always a good part of your day and a good part of your work.
Right. My last question is, what advice can you give to, obviously your chiropractor, but an oncoming massage therapist based on, the massage therapist that you've worked with before?
Oh yeah, absolutely. I think especially when you're looking at a massage therapist who's trying to do an independent practice or something on their own, doing some kind of business classes, looking at accounting, doing things to make sure you're setting yourself up for success in that way. Because you're coming in with your knowledge for massage, but the business aspect is definitely a different ball game.
Right. It sounds easy theoretically, but I may struggle with that part. So I might have to work with another massage therapist before I can do my own thing. I really appreciate you taking the time. I hope to visit again. I know that when I was there wasn't a lot of time between clients, so I appreciate you letting me take a couple pictures and just skedaddle. I hope that I can come back again and maybe get a treatment from you.
Absolutely. Come in anytime, and thank you for your patience and flexibility, Alexa.
Thanks. Have a good day.
You as well. Bye.
Shoulder injuries, rotator cuff tears. So